All right, thank you very much, and welcome everyone, those who are here, and probably a few more who are joining us as we make a timely start. I'm Elizabeth Egan. I'm the new head of the School of Public Health, and it's thrilling tonight to have everyone join us to talk a little bit more about our unknown futures and the role of public health beyond 2020. So if we could go to the next slide. Thank you. And I'd like to start the way we always do here in the School of Public Health and at the University of Queensland with an acknowledgement of country. So I'd like to acknowledge the traditional custodians of the land on which we meet. And today for us here in Brisbane, that's the Yagara and Turrbal people. In particular, I want to acknowledge their very long-standing contributions to teaching, to research, and to public health, to caring for the health of community. I especially want to welcome any Aboriginal and Torres Strait Islander students or colleagues who have joined us tonight. So I'm keeping my introduction very, very brief because really you're all here to hear from our expert panel of academics in the school tonight. We all know it's been an incredible year for public health. It's been an exciting year. I think everyone in the country now knows what an epidemiologist is, so that's a nice thing for us. But tonight we're here to really explore other opportunities in public health, for you to, again, hear from some of our experts, but for us to be able to take some of your questions. So we hope for those of you who aren't already a part of our school community, tonight will inspire you to join us. Thanks. I'll turn over to Associate Professor Simon Reid now.
Thank you. Okay, thanks very much, Liz. So I'll just, I'd like to start the proceedings by introducing our team of panelists. We have, I'm joined by three of my academic colleagues, as well as, I suppose, our head of school. I guess to introduce myself, I'm a keen advocate of approaches to tackle the sorts of problems that we're dealing with in 2020. So these issues of diseases that jump from animals to humans, we call them zoonotic diseases. My colleague Linda Selvey is joining us. Linda is a public health physician, and her main interest is in infectious diseases. And Linda is a past director of the communicable disease branch of Queensland Health. So she comes with a wealth of experience in managing disease outbreaks and disease problems. Linda has a very broad research interest, particularly around climate change and bloodborne viruses. My colleague, Associate Professor Shelley Lawler, is a health psychologist, and she studies behavioural approaches to disease prevention and health promotion. Shelley has a very broad set of interests in understanding how to improve behavioural interventions, and she works with me on infectious diseases, as well as working with others on helping people improve their lifestyle. And our final panelist is, sorry, we have, I'm sorry about that. We have Associate Professor Coral Gardner, who is a specialist in environmental health and tobacco control, and her interest, she'll talk a bit more about her research interests later in the discussion, but she has a very strong focus on the regulation of tobacco and tobacco control. And our final panelist is Professor Charles Gilkes, who is an expert in HIV and global public health. And again, Charles is an infectious disease specialist and has worked in many different countries in the world for the World Health Organization, as well as the United Nations AIDS program. So I'll just move on to the next section. And what we'd like to do then is just have a brief discussion with the panel, and I'll just stop sharing. And so you can now see the panel. What we'd like to do now is talk to you a bit about what's happening in the world today. So 2020 has seen public health really emerge from the shadows. We feel that it's now the topic of everyone's conversation, and most people have heard of things, people like contact tracing teams and epidemiologists. So we really are quite front and centre in terms of the sort of general public. And I guess what I'm going to do is turn to Linda first to ask, you know, we've seen the headlines, you know a lot about your experience in COVID, but what's the role of public health in a situation like we're in with the pandemic?
Simon, public health is central to the whole response in the pandemic. While clinicians are busy treating patients and laboratories are very important in terms of diagnosing the condition, in this case COVID-19, it's public health that really collects all that information, follows the state, how the epidemic's going, institutes responses, critical responses such as contact tracing, and it provides advice for decision makers on what other steps to take given what is known about the pandemic. Public health also often is involved in doing action research and trying to understand more about the pandemic, which is absolutely critical in the early stages, trying to understand better who's most at risk, how it's being transmitted and so on. And also modelling what is expected to happen in the future so that, we're in a better position to advise government on what steps to take.
Thank you, Linda. And Shelley, I'd just like to turn to you as a behavioural scientist, because we see a large part of the public health response that has been implemented is really around human behaviour, and there's lots in the press and the media about good and bad human behaviour. So can you tell us a bit about the role of behavioural science in a pandemic?
Absolutely. So one of the key things that that has happened in terms of the pandemic is pretty much everyone across the globe has had to change their behaviour. And it's not just one behaviour, we've had to change multiple behaviours. So it is from keeping our distance, washing our hands, wearing masks if that's what the evidence is showing for that particular location. So it is, and staying at home when we're sick. So there's multiple behaviours. Now it's difficult normally to change one behaviour. So to have across the globe changing multiple behaviours is quite an immense task. And in Australia, we've been very successful at doing that. And you know, that's why we have the pandemic at the point where it is, where we have very few cases happening across Australia. So it's going to be an ongoing issue in terms of maintaining people's behaviour change, and we'll have to see what happens as that pans out. But it is a great research opportunity for us because we are seeing people who are changing their habits. We can understand how that's happening, what are the perceived risks around that, and we can start to look at people's belief and their attitudes, where they're gaining their information. That is going to help us in the long term in terms of understanding behaviour in a pandemic.
Thank you, Shelley. So I'd now like to turn to Professor Gilkes and ask for a global perspective on the role of public health in I suppose, global public health in the pandemic.
Thanks very much, Simon, and my apologies for being a little bit late in joining everybody. So I think it's quite clear when you talk about the role of the global public health institutions, we're really here talking about the role of WHO. And this is critical for several reasons. Firstly, WHO needed to call this as a pandemic. And you will remember, or many of you will remember, that there was quite a lot of controversy about what some people thought was a delay in WHO calling it a pandemic, which meant that there was a series of global interventions that needed to be put into play. And WHO is also responsible for tracking the global statistics, although I do have to say that the Johns Hopkins School of Public Health is doing a much better job in producing very rapid, up-to-date data. Because it's key, as Linda was saying, understanding and tracking the progress of this virus in communities in different jurisdictions, because that really triggers what you need to do. If the the virus, if the numbers of infections, number of cases of SARS-CoV-2 are going up, you really do need to think about what behavioral interventions, so you're going to, as Shelley was talking about, you're going to ask individuals to implement. And you need to think then about what interventions you're going to do at a societal level, locking down, thinking about the economic consequences and how you plan for that. And WHO is crucial in organizing and helping implement or suggest what those global policy interventions should be. And and I could go on, because most of my experience was around a previous pandemic, the HIV and AIDS pandemic, which it's interesting to see the similarities, but also the differences in how the world understood there was a pandemic emerging, the critical role of a public health response as opposed to an individual clinical doctor-nurse response, and how you need to get on top of these things and recognize them. But I think I better stop, because there are lots of other people who've got things to say.
Thank you, Charles. So I guess I'd just like to add a final role that public health is increasingly playing, and this is in the sort of the interface between the public health agencies and animal health and environment agencies. And we talk about this as, we call it One Health, which is looking at the interface between humans, animals and the environment. And of course, we know that SARS coronavirus 2 has emerged most likely from an animal reservoir. And the challenge for us is in contributing to, I guess, the future of research and control measures to try and reduce that risk. And this is a relatively new area, and it's still an emerging field, but it's one of the critical parts that our school in particular is keen to play, and that is just in trying to understand how we take the risk out of the food sector, because food is such a critical part of life. So the breadth of public health in terms of the responses, but also in terms of the types of interests our academic staff have, is incredibly broad. I would imagine that the majority of people in the school have looked at some level of interest in aspects of the pandemic for their own research, and particularly we use the pandemic as a critical part of just about every part of our teaching now, because there are so many lessons that we've learned about public health in the year to date. So what I'd like to do now is just move on to, I guess, other topics in public health, and start talking about some of the areas, the other areas that our panelists work in, to give you a flavour of the sort of breadth of interests, but also some of the experiences that you might have in interacting with academics and other students in the school. I'd like to start by turning and asking my colleague Coral to discuss her work that she does in the area of public health.
So I guess my main interest is in a different pandemic, which is the cigarette pandemic that is driven by commercial, it's a commercially driven epidemic of non-communicable disease. So one of the very exciting things that's happened this year is that we've gotten a Centre of Research Excellence funding to set up a National Centre of Research Excellence on achieving the tobacco endgame. So what we'll be doing is looking at the new strategies that we need to put into place if we want to actually end this major cause of disease around the world. So something that has come out of the COVID-19 pandemic is a renewed interest in what new strategies we should take forward in tobacco control, actually. So we had in South Africa, for example, they declared cigarettes to be a non-essential item, and so they actually banned the sale of cigarettes for a time. And so this has opened up a whole lot of avenues for researching what happens if you actually take this product off the market. Everyone has just assumed that this product has to stay on the market. But this unusual situation has also led to opportunities for us to see what happens actually if you change the retailing of this product, which causes so many deaths internationally.
Great. Thank you, Coral. So I'd like to next turn to my colleague Shelley to talk about a bit of the research that she does.
Okay, thanks, Simon. So broadly, my research falls into the field in terms of health promotion, and I work across non-communicable disease and infectious disease as well, very much looking at the role that behaviour plays, but also the interplay in terms of behaviour with a range of determinants in terms of some of the psychological factors. So I do have a breadth of research interest where I do work with Coral and some of the tobacco cessation interventions, from community kind of interventions through to, I guess, more clinical interventions in some ways. And I also work with a team of people looking at the role of M-Health and how that can be integrated into Aboriginal controlled community health services, particularly in terms of controlling hypertension. So I have a breadth of research interests, but it's all predominantly about improving the health and well-being of our populations.
Thank you, Shelley. Can I just ask you to talk a bit about the COVID survey that
Sure. So because of my breadth of topic, I have been able to work quite quickly and look at what's happening in terms of the COVID behaviours. So we have a survey that has been conducted across the US and in Queensland and New South Wales. And what we've done is we've actually looked at a range of and measured a range of predictors in terms of COVID safe behaviours. And these predictors that we're looking at are things like risk perceptions, beliefs about the disease, stresses, anxiety, depression, some of those psychological factors that might be playing a role. We've also been looking at where people source their information from. And this is turning into probably one of the next public health issues that we're going to face, and that is around the spread of misinformation. So it's an important avenue to research, to understand where are people getting their information from, how do they understand it, how do they interpret that, particularly in relation to COVID. So we have done this survey and we have been lucky enough to gain some funding to actually now roll this out in Indonesia. So we're going to get 3 very different countries in terms of their political systems at play as well, and who's in government. So political trust is also something we have measured in this survey. So watch the space in terms of findings.
Thank you. So can I just pass on to Linda now for a brief overview?
Sure. You mentioned earlier that I've got a research interest in bloodborne viruses, and I'm particularly interested in hepatitis C and other bloodborne viruses as they affect marginalised populations. So I've been doing a number of studies relating to how it can actually increase hepatitis C transmission amongst hepatitis C treatment amongst people who inject drugs, which is part of a global push to eliminate hepatitis C as a public health problem by 2030, now that there are new treatments that are capable of effectively treating with minimal side effects. I've also had, over the years, done quite a bit of work in relation to public health surveillance and disease control. And most recently, I'm involved in a couple of studies looking at COVID contact tracing, the influence of the app in collaboration with the Kirby Institute, and also is involved with developing the metrics for how you actually know whether the contact tracing is working. I've also done quite a lot of work on Clostridium difficile. Many of you may not have heard about that, but it's a gastrointestinal pathogen that has very hardy spores. That means that it can last in the environment for many years. It gets transmitted. It has been transmitted very effectively in the hospital setting, but what happens in the community setting has been much more neglected, particularly the role of food. So I work very closely with Professor Tom Riley in University of Western Australia in that area. And in terms of climate change, I've been working on the impact of heat on health. There's a lot of work in terms of extreme heat, but less is known about low intensity heat and its impact, particularly in climates such as in Brisbane, where we have hot, humid summers. So I've been working with Queensland Health on that.
Thank you. Okay, I'd like to just turn to Charles now.
So thanks, Simon. There are two areas of research that my team is actually working on at the moment, which have got direct analogies with some of the responses and interventions that are happening around COVID-19. And the first is with HIV is to try and reimagine testing and tracing. Contact tracing is when you intervene with a group of public health nurses or clinicians to try and work out how an individual who's been infected, where they got that infection from. And you'll have heard a lot about that in Melbourne, in the lockdown, about, trying to understand whether somebody who was infected, whether they were a case which couldn't be described and it was an unknown case, or whether it was linked to a current cluster of infections. So we're trying to do exactly the same, reimagining testing and contact tracing in the COVID era using analysis of the virus itself, which is exactly what people do with COVID, with SARS-CoV-2. You get the specimen, which the antigen specimen, which has part of the virus in, and you look at the virus and you see whether it's the same in a cluster or whether it's not the same. And then there's a second piece of work that we've been doing, which is around using effective drugs for prophylaxis. We're familiar with this in the context of malaria. If you go away on holiday to a malaria zone, you will take effective anti-malarial drugs for treatment to prevent you getting infected. We've been doing the same, and that was initially something people were trying. You remember the controversy around using hydroxychloroquine as an agent to prevent or treat SARS-CoV-2 and treat and prevent acquiring COVID-19 infection. We've been doing exactly the same with effective AIDS drugs to see how they can be used in pre-exposure prophylaxis to prevent treatment. We were involved in a large implementation trial across Queensland, and we're still analysing those results, which involved over 2,500 people who were at risk of acquiring HIV and were taking pre-exposure prophylaxis. There are lots of other things around behaviour, trying to promote behaviour change, but I won't go into that. I think that's enough from me now.
Okay, thank you, Charles. And I guess just to say a few words about my own research interest, I, for a long time, have worked in countries in Southeast Asia and the Pacific. And I guess I join a number of people in the school who have a global or an international interest. So we do have I guess, research and teaching interests that expand beyond our borders. And one of our fields of study of the Masters of Public Health is global health. So, the types of research that I'm involved in include, I guess, exploring some of the global governance issues. So global issues like the way that the World Health Organization helps countries prepare for pandemics and how that does or does not correlate with the current pandemic. So there is looking at the most sort of senior levels of policy making to see if the structures that we have in place actually will help us next time there's a pandemic. And I'm particularly interested in helping, I guess, bridge the gap between the animal and human health worlds, because my background is as a veterinary scientist, and I work closely with colleagues like Shelley to look at the role of behaviour of people, particularly when it comes to diseases they pick up from the environment and from other animals. So we have I guess just a snapshot of the research that's being undertaken in the school. What I'd like to do now is move us on to talking about the future. And so this part of the webinar really is for us to have a brief discussion about where we see the future going, and I guess moving towards discussing the role that the training programs are now learning, the learning opportunities in the school, what they offer to you in terms of the way that you contribute to the future. So I'd like to turn to our head of school, Liz, first, and talk about career opportunities and really, you know, what we as a school are trying to achieve and what sort of people we're looking for to join us in that journey.
Thanks, Simon, and thanks everyone for those really interesting snippets of the work that you're doing. So I guess, Simon, it's really clear, you know, hearing from just the small group of our academics who are on the line tonight, that the fields that people trained in public health go into as career are as vast as probably any other field. So we have behavioral scientists, social scientists, medically trained people, epidemiologists, veterinarians. I work with exercise psychologists here in the school, dietitians, social scientists. We really, the people coming into public health, as well as the options for careers coming out with a public health degree, are absolutely enormous. I guess if you want to kind of pull it back a little bit, really we're looking to turn out here in the School of Public Health the next generation of public health leaders. And those are people who are going to go out and work in community settings, in NGOs, in clinical and medical settings, in hospitals. I think in schools, there probably really isn't a setting where public health doesn't have some relevance.
Great, thank you, Liz. So what I'll do now is just again go around our panelists to look at, in terms of changing in the area of public health change, what can we do to better prepare for future challenges, including pandemics? So in some ways, you know, how do we prepare the next generation of public health workforce, you know, to cope with the unknowns of the future? So again, I'll start with Coral, if I can ask for Coral's opinions on how do we change the future?
Well, I think we already know a lot about preparing and also for implementing public health interventions. And so it's having that preparedness there, people with those skills that are ready to go. And, you know, we can learn from different fields. So, for example, the tobacco control field has some excellent examples of how to help people to make healthy choices through behavioural economics and so on, and that can be transferred into other areas as well. So the next public health challenges can learn from the lessons from tobacco control or from alcohol control, so on. So I think there's also a lot of opportunities for learning from how we have managed other public health issues for the new emerging issues that will come our way.
Great, thank you, Coral. So Linda, I'll turn to you for your future predictions.
Yeah, well, we can't talk about our future without talking about the climate crisis. It's upon us, and we know that things will get worse even if we were to stop all emissions. We became net zero emissions now, our world would continue to warm. So what that means is that there are many, many implications of that for people's health, and it will affect all of our health. But the many different ways that climate change affects our health means that we need many, many people with quite a range of different knowledge and skills in order to be able to respond to those, and to expect the unexpected, I guess. And I think therefore, you know, public health people will be critical in this overall response to health impacts of climate change as well. And some of those skills that will be particularly important, apart from some of the things that we've already spoken about and what Coral spoke about, is the capacity and the ability to work across disciplines and work with people from a range of different, with a whole range of different knowledge and a whole range of different decision makers and so on. And that's, to me, in my career in public health, has been what I've found the most satisfying, that I could, you know, a day in my life as Executive Director of Public Health would include dealing with water authorities, clinicians, you know, non-government organisations, a whole range of different people in any one day. And having those skills to be able to do that and to be able to talk similar language and to be advocates for public health in all of that is important now, but will become even more important in the future.
Great. Thank you, Linda. Shelley, I'd like to hand over to you.
Thanks, Simon. I might build on what Linda and Coral have been talking about. You know, climate change is one of the biggest challenges that we are facing as humanity. And of course, I think I bring it back to what my core skills are around, and that is around behaviour change. And of course, it is going to take a lot of behaviour change for us, because a lot of what we do on our day-to-day basis, we need to change and we need to become aware of. But then we also need to think about the drivers in terms of what Coral was talking about in terms of those commercial determinants of health. So what I think that's going to be really important when we think about public health and moving forward is really understanding systems and how they operate. And I think that is going to be key for future public health graduates. Not only that, in terms of advocacy. So if we go back to the foundations in terms of public health, we've been doing this well for a long time. We're just going to have to keep doing it better in terms of our advocacy skills, building capacity. We're going to have to constantly be lobbying our governments to make sure that this issue stays on the agenda.
Thank you. Charles.
Thank you, Simon. Well, I think looking to the future, the most important thing is, as Liz was saying, is building a trained workforce. And I think if we're going to invest in the future and focus on the future, we've really got to think about how we skill up the next generation and the next generations. Let's look way into the future. So people have a broad understanding, which they will get at the School of Public Health in all the different discipline areas that are so important. And I think for me, the most important is actually counting, finding out what's going on, the importance of disease surveillance, whether it's the obesity epidemic, whether it's the epidemic of non-communicable cardiovascular disease, heart disease, and so on, or whether it's a current or an emerging pandemic. It's being able to recognize and have trained public health practitioners who are able to properly mount effective surveillance and monitoring across whatever the particular disease is. And particularly, going back to the issue of global health, I'd like to emphasize that the entry ticket to all of the UN agencies, if any of you are interested in a career in global health, is through an MPH. It's not through a clinical degree. And I'll tell you, having worked for 10 years in WHO, it's having an MPH. And it's the same for the World Food Programme if you're involved in providing nutrition support, or you're looking at the epidemic of obesity at the same time as undernutrition. The World Food Programme's just won the Nobel Prize. They're looking for MPH graduates, and they're looking for MPH graduates from good schools that have a good reputation. Same for UNICEF, same for Food and Agriculture Organization, and so on. So I think our importance is in training the next leaders, as Liz was saying, for the future. And it's not just for Australia, for those of you that has an international perspective. And the key is an MPH or a Masters of Epidemiology.
Well, thank you, Charles. So I guess it's a good opportunity now to start moving in to tell you a bit more about the school. And my role in the school is as the Director of Teaching and Learning, which means I sort of have oversight over all of the teaching and learning activities in the school. And I must say, so I guess to synthesize what people have said, it's really the key features of public health as a career. And we 2020 has actually created a bit of an evolution in the way that we imagine, well, that we view, I guess, the future of our education. It's been quite a pivotal year in a number of ways. But one thing we do know is that this has sharpened our focus on making sure that we have graduates who are capable of working across these areas of disciplinary work, but also capable of working in a time when there's a lot of uncertainty. And so some of the skills that we do emphasize are critical thinking skills as well as communication skills. And increasingly we will introduce, I guess, new ways of thinking as well as new ways of working. It's also a good time at our university. UQ has invested $41 million into the student strategy that we have. And the student strategy, I think, is quite unique. And in talking to a number of colleagues in the US as well as Australia, most universities do not receive a sort of a centralized funded strategy. And one of the cornerstones of the student strategy has been driving flexibility in the way that we deliver our courses and programs, and flexibility in the way that students engage with them. So 2020 for us has been one of those years when all of that's come together, and so we've benefited enormously from having access to that sort of investment. And our centralized learning and teaching institute has been sort of quite critical. So before we get on to the questions that you've posed, I'd just like to quickly run through the sort of suite of courses that we have in our school. So we have 5 master's programs, and each one of these, four master's programs, and each one of these is a suite of 3 courses. So each topic area has a graduate certificate, which is 6 months of equivalent research teaching, 12 months, which is a graduate diploma, and a full year and a half master's program. So we have an environmental health sciences degree, which is brand new, and public health, masters of public health, epidemiology, biostatistics, and I'll mention a brand new short course we're running in the summer semester in about 6 weeks. So, as I said, before I talk about our courses, 2020 was a critical year. And what's interesting for our school was that virtual learning, so external students learning online, learning asynchronously as well as synchronously, is not a new concept for our school. We've been doing this for a number of years because about half of our student cohort study with us externally from distance. Many of those people are in the workforce. They may even be in Brisbane. So we often see them when we run intensive courses or we have nighttime sessions. But essentially our cohort of students is a mixture of fairly young, recent graduates, as well as mature age students who are returning to training from the workforce. And we also have a growing cohort of international students who come from a very broad range of countries, from as far away as the South American countries, as well as African countries, and of course a lot of Asian and Southeast Asian countries. So it is a very mixed cohort, a lot of diversity and a lot of energy created by that diversity. This year we've really changed our way of approaching our course delivery as a result of the need to teach more online. And this has accelerated a process that we've been going through for a number of years. So from a school perspective, it's been extremely pleasing to see the positive responses we've received from students with regards to how well we've been able to transition to online, and particularly for our external cohort who really have benefited from a sort of an enhanced learning environment. keeping pace with that is the university, who are investing a large amount of resource into increasing and improving our digital capacity. So the learning platforms we use and the support for staff. So the Masters of Public Health and the field of public health is this broad field, a lot of what we've been discussing tonight. And it focuses on the prevention of disease and promoting healthy lifestyles as a core. But as we've discussed with infectious diseases, it also focuses on those sort of health interventions aimed at preventing the transmission of infectious diseases. When I joined the school 8 years ago, I was really struck by the diversity of the teaching staff. And I don't know of any other academic environment where you'll find an anthropologist and a sociologist working alongside a biostatistician and an environmental scientist. The diversity of staff are required because of the diversity of the topics we teach. We've been very successful with our Masters of Public Health in gaining accreditation. So a few years ago, we gained accreditation through the European Public Health Agency for our MPH. And we did this because we wanted to benchmark our course against the sort of global standards. And so this is the accreditation that every European public health school attains for their degree. And last year we were very fortunate in also receiving accreditation for our health promotion plan. So the field of study in our MPH is an accredited pathway to being a practitioner as a health promotion practitioner. And that was largely organised by Shelley. So within our current program structure, there are 6 different fields of study that you can pursue from diverse topics such as alcohol, tobacco and other drugs. So this is the management of substance use, through global health, the accredited health promotion pathway, Indigenous health, nutrition as public health nutrition, and we also have a flexible standard pathway which allows greater flexibility. So you would have heard a lot about epidemiologists, and what's interesting is that prior to 2020, most people hadn't heard what an epidemiologist is, but we have a dedicated degree, a master's degree to train epidemiologists, and this is particularly training people in very high level research skills in inquiry and understanding the patterns and the causes of disease and how they contribute to good health as well as poor health, and how to, I guess, almost feed back into the broader public health community, who will then work alongside epidemiologists to make changes and provide interventions to improve. We have 2 areas of study, fields of study: clinical epidemiology, which is designed really for people interested in working on research teams and doing clinical trials, as well as clinical research within a clinical environment. And we have a broader, standard, more flexible plan that suits people who are interested in contributing to public health epidemiology. Our biostatistics degree is part of a very unique collaboration in Australia. It's a collaboration of 6 universities that deliver this program across the universities. So each student will enrol in a participating university and then take courses and join cohorts of students from across Australia. As I said, it's quite unique, and what it provides the students is with a very sort of diverse experience of different styles and different information. And also you're being taught by some of the sort of foremost biostatisticians in Australia. This is quite, I guess, maths and quantitative science heavy, but there are a number of opportunities to strengthen your your skills and your knowledge in maths and statistics as you enter the program. This program this year was one of our short courses which was offered as part of the Binge on Learning, not Binge on Netflix, that the Australian government funded. So our final program is Environmental Health Sciences, which, as I said, is a new program. Coral Gartner is our program director. And this was specifically designed in response to a request from our health department who identified a gap in training for people interested in working in environmental health sciences more broadly. And we tend to talk about this as regulatory science, or science that supports the development of programs and guidelines to manage risks from the environment. And these risks could be everything from plastic contaminations, chemical contaminations, and challenges like the firefighting foam issues that have come up recently. That all falls squarely within environmental health sciences. And just to finish off on the courses, we have decided to run a very specific course in our summer semester, and we run a summer semester every year with a small number of quite specific courses. And this year we're putting on a course in pandemics. And this, for those interested, might be a potential starting point, because you can begin your program in summer semester. And this course is designed to provide the broadest understanding of the role of public health. So taking what we discussed tonight and expanding it across the sort of 3 or 4 phases of the pandemic. So we'll be covering the sort of planning and initiation of a pandemic response through to the activities needed to grapple with the second wave that we're experiencing, and then looking at the broader impacts and the opportunities for improvement. The course itself is offered both externally and on campus flexibly, which is the first time we've done this for our intensive courses. So it'll be a unique experience for those interested. So we've got some questions on the Q&A, and in fact, one of the questions is a wonderful segue back into our panel. And I'll direct this towards Linda, if she could talk to a question from Satya, who asked, you know, what changes would we suggest in response of a government in the wake of a pandemic? So I presume that refers to the changes that perhaps the government might make after this pandemic.
I think one of the things that has become really apparent in Australia is different levels of investment in public health around different jurisdictions, and I think that's really shown up in terms of the success or otherwise of responses. So I would say one of the first things that I think has already been flagged by National Cabinet is a greater investment in public health and in public health people. So that's good news for people thinking about moving into public health and for the community in general. I think some other things is that we probably do need, or we do need to look in the long term about other infrastructure to assist us in responding. So while it hasn't been a flagship in this pandemic, the US CDC, Centers for Disease Control, has been a flagship in response to many diseases until it was highly politicised and underfunded. But there has been a lot of discussion nationally about developing an Australian CDC and really helping in getting that kind of broad national response as opposed to just working as individual jurisdictions. And then I think there's a whole lot of things that we probably will do differently, and where we need to think about how we might invest to keep people well, even designs of workplaces and public transport and so on, so that people are less prone to catching respiratory infections from others, and that'll be good for us in the long term, even after we're all immune against COVID.
Thank you, Linda. Shelley, you've just attended a seminar, a webinar on the future of the public health workforce. Can you just share some of the outcomes from that?
Sure. So some of the highlights actually Linda's already touched on, that we need to have, I guess, funding in terms of building the public health workforce, and also, I guess, more broadly in terms of the healthcare workforce as well, and that this is very much needed. Another key area that was discussed in this webinar, which Paul Kelly was part of, is that that we need to make sure that we're having input into consultancy documents around what is happening in terms of our workforce and healthcare. The other area that was discussed is the role of accreditation and how important that is, that we actually have a global set of competencies that we are working at in terms of public health. But one of the key areas that they discussed is the role of public health officers, and that this will be a growing area in the coming years.
Yes, with potentially recommendations for an increase in the workforce. Yeah,
absolutely. Yeah.
So it's interesting, the pandemic has sparked the development of a workforce planning document for public health. Is that correct, Shelley?
Yes, that's right. So it is. There's meant to be an announcement in the middle of November.
Okay, thank you. So just moving on, Shelley, there's a question here for you. What kind of opportunities do you foresee, if any, in the overlap between misinformation and public health? And do you think governments will support growth in this area?
Yeah, that's a very good question. It's very topical. So we saw just a couple of weeks ago Howard Zucker from New York, who's the Commissioner of Health, basically wrote an article for the American Journal of Public Health stating that misinformation is actually already our current pandemic because it spreads faster than infectious disease. So he was pretty much calling everyone that we need to be working in this space. And then we've seen follow-on discussions around this, particularly about the role of tech companies like Twitter and Facebook and all of the social media platforms that should be hiring people that understand the information so that that information doesn't spread as fast as an infectious disease. So I think that is going to be a growing role. And, you know, accurate information is what our foundation is in public health. We need to make sure that we are having, you know, using the evidence. And this will go back to, you know, the education that we are receiving, and also teaching in terms of public health graduates.
Thank you, Shelley. So just going down the list. So this one's a question around political attitudes. So to what extent do you think people's political attitudes influence their attitudes towards accepting public health advice? And is this a growing challenge? Shelley, I'd like to pass back to you because we do have data on this.
Yeah, and it is preliminary data, but we do see even what we've looked at from across the US to here, it does look like political trust obviously is playing quite a big role in terms of people listening, the type of media that they're getting their information from, and whether they're partaking in their COVID safe behaviours. So I think it is important, and but of course our political attitudes or stem back to our values as well. So this is where we start to see that at play across all the different countries and different government structures that are in place across the globe.
Thank you. And I think, if I'm not wrong, it was also, there was associations between other risk-taking behaviours that impact health, such as smoking. So yes, this issue about the core values and the way that expresses itself in health behaviours is I guess, an emerging theme.
Yes, that's true.
So, Linda, the next one's for you. How can we, as students, academics, and, oops, sorry, the Q&A's moved, better articulate the public health consequences of climate change to audiences or governments that don't support climate change policy or perhaps even doubt its existence? And I did note that Boris Johnson called Scott Morrison and asked him to do something.
Yes, I think health voice is becoming increasingly important in terms of advocacy for action on climate change, and because of the health consequences, but also because health practitioners are generally held in very high regard in the community. But I think in terms of how we do that communication, I think it needs to happen at a whole range of different levels. And one of the things that everybody can do is both talk and listen to people, you know, your friends and relatives. And I think what we know about people's understanding about climate change is that in Australia, for example, the majority of Australians believe the climate science. But when you delve deeper into that, for a lot of people, that's kind of background, well, it's background in people's minds, not foreground, which is understandable because we all have a lot of things going on in our lives. But in order then for it to affect things like voting and the pressure that we put on decision makers, it means that it needs to become closer to the foreground. And that's where conversations and so on can be really important. Just giving people a chance to voice their opinions and to listen to them, and for you to do that as well as a health person in particular. And keeping informed with the science is really key too. Unfortunately, we're seeing more and more impacts of climate change, and as the earth warms, it's useful to understand those and be able to talk to others and in broader forums as well about that in a way that both people can understand but also not switch off.
Great. Thank you, Linda. Now there's a question for the panel that I'll leave up to whoever wants to answer, because I'm not sure who to direct it to. What is your opinion on furthering the role of social media engagement to deliver the message of most public health causes, considering the world is increasingly becoming more digital? Does anyone want to volunteer? Who feels best placed to answer that? I'm looking at Shelley, but...
Hey, well, I was wanting to see if someone else wanted to take a go. I feel like I've been talking too much. I think social media obviously plays a role. It is a modality in which we're the way we can, I guess, share the messaging in terms of the health messaging. But as we've already highlighted, social media has its ups and its downs in terms of the sharing of information. But yes, social media has been used successfully in many campaigns and is continuing to be used successfully. I guess what it is, it's about educating people to understand the types of organisations that they should be following on social media to get the accurate information. That's the challenge.
Thank you. So just keeping on, yeah, Charles, please.
Yeah, so I just wanted to tie this up with also the role of political leadership. One of the things we learned very early on in the AIDS response to the AIDS pandemic was the importance of political leaders in understanding what was going on, and that had to be based on evidence and figures and numbers, and to overcome their prejudices. And sometimes this worked and sometimes it didn't. And I'm afraid we've got some stunning examples at the moment of the failure of political leadership in COVID-19, when you think about how wearing a face mask has become a political gesture rather than a public health response and a behavior change that is there to protect you and the community. And that comes from the, dare I say it, the ignorance of a political leader called Donald Trump. And then you can look at the sensible way in which one of our state leaders down in Victoria has responded really very, very well. He's listened to the information and he's been able to bring on board the community so that they have accepted and recognized the need for a really significant and draconian lockdown, and how now Andrews's response is being heralded and lauded around the world as a dramatic response. It's the best response to a second wave that's been seen, and that's received international acclaim. So it's the importance of political leaders, their understanding and how they can get that across through social media and whatever else ways they're communicating. And it's to really, there is a role in that, the political leaders to get on top of and do not deny fake news. So fundamental political engagement here in COVID-19, as it was in the, as it remains with the HIV/AIDS pandemic.
Thank you, Charles. So moving down the list, there's a question here from Darren, which I think may have been answered already, which is the best way to tackle misinformation for COVID and climate change. I think we've probably answered that one, Shelley. Is that?
And Simon, could I just interrupt for a minute, because I'm noticing we're at 7 o'clock, which was our advertised close time, and there's still a number of students who have some really good questions about the program. What would we suggest to them about getting in contact with us? And
we certainly, I think the Future Students page has the contact details. Do you think we can continue for a few more minutes?
It's yeah, fine with me. I just think there are probably more questions though than we can get to in even a few more minutes. So yeah. I want to just make sure that students who have questions know where they can go to get them answered.
So the place to go is the Future Students page for our program, our school programs through the UQ Future Students site. I think perhaps if I could ask Phil if he could post the link on the
oh, super.
To all the attendees, and I'm sure it's come probably in an email to them as well, hopefully. Okay, Liz, thank you for pointing out the time. So if everybody's happy to stay online, we'll quickly run through some of these other questions. There was a question about Masters of Dental Public Health alongside the MPH. Sadly, I guess the dental school is in another faculty. We do have students who come from a dentistry background and are more interested in studying public health. And to some extent, they're better off with a Masters of Public Health than applying it to dentistry possibly, because it forces you to learn in a different disciplinary context. So I think the achievement, the intent of studying public health from a dentistry point of view is probably achieved with an MPH. That's certainly what I advise anybody who has a veterinary degree and they want to work at the intersection between animal and public health. The best thing they can do is stay away from their own discipline and learn as much from other disciplines. So there's some questions here about plans, which I think Shelley is best placed to either answer through the chat. There's one about what types of plans to take and with the optional 2 years of study. So I'd ask Shelley if she could answer that one by chat. In terms of seeking jobs in the public health sector, it's I guess it's always a challenge, particularly now in a recession. But we certainly are happy to speak to any of the graduates that we have or any graduates who are nearing graduation and talk through career options with you. The point of contact for the MPH is through Shelley, but she can also engage different academics to help you get an answer from a particular work area, because public health is so broad. So there's a question here about international travel and whether we'll be stuck with COVID in the future. I think that depends a lot on the vaccine. I think you'd agree, both Linda and Charles, that with the vaccine we will see the rise of regulated travel, possibly with the requirement for proof of vaccination or proof of immunity. Without a vaccine, I guess it depends to some extent on the public health or the political responses to that event and whether we feel we're achieving herd immunity in a space of time that makes it safe for the public health, the healthcare sector to cope with the cases that may occur. I'm not sure if Linda wants to add to that.
Yeah, I was just typing in an answer when you were, before you got to that question that I've just sent. Regardless of whether or not there's a vaccine, we'll have to continue to have really good surveillance and disease response. We haven't been able to eradicate, we've only been able to eradicate one infection to date. So yeah, that will change. I think that people will potentially resume travel, but in terms of the public health response, that's not going to go away. That is, if there is a vaccine. And there will be a need for ongoing contact tracing and other measures as well. So yeah, if there's no vaccine, I think still it's likely that over time countries will open up their borders again, but they would need to make sure they've got very good surveillance and control measures in place.
Yeah, thank you. And Charles?
Yeah, I just wanted to make the point about a vaccine. It's not actually having a vaccine, it's making sure that a vaccine is distributed and made available to very large numbers of people across the world who will need it. And that really is going to be the rate limiting step, assuming we get one that's partially or very effective. It's going to be how quickly we can vaccinate the world. And that may take a couple of years. Tony Fauci made the comment quite recently in the US that it isn't whether the vaccine's going to be there in December or not. It's actually going to take, even in the US, 4 to 6 months to take the time to vaccinate those in the US who have declared that they're going to use a vaccine, because of course anti-vaxxing around a SARS-CoV-2 vaccine is now a political statement as well. Crazy world we live in.
Yes, thank you, Charles. And so there's a question from Linnell about tackling misinformation around COVID vaccines. Vaccine hesitancy was identified last year as one of the top 10 global health threats by the World Health Organization. So this is a topic that is, I guess, being tackled as much as possible through behavioural change and education programs. And I guess it's to some extent not really that much different to a lot of other health issues that are sort of complicated by misinformation. And it is a personal choice, and the challenge in public health is weighing up the personal freedoms of allowing people choice with the sort of consequences of that choice. And I'm not sure there's a magic bullet, because the vaccine hesitancy is a complex problem. It's not a simple one to solve, and it's not a single problem. I think there's probably just one.
Simon, can I just say that one of the issues where COVID-19 is perhaps easier than something like measles is that you don't need to vaccinate 95, 96% of the population to get vaccine-induced herd immunity as you do with measles, because measles is so immensely transmissible. You only probably need, looking at the most recent modeling data, to vaccinate maybe 40 to 60, perhaps 65% of a population with a moderately effective vaccine. And the key issue is then how long vaccine-induced immunity will wane, because it's clear natural infection, the immunity to it, like for the SARS, the common cold coronavirus, is pretty weak and but relatively evanescent.
Great, thank you, Charles. So I'd like to wrap up there. The remaining questions have mostly been answered by our panelists by typing into the text. But I'd like to thank firstly my colleagues and fellow panelists, Coral, Linda, Shelley and Charles, and our head of school, Liz, who had to step out to another event. I'd especially like to thank all of you as attendees for taking the time to talk to us about, I guess, the the future opportunities in the school, and hopefully this has given you some, I guess, some ideas and imaginings of potential, I guess, career pathways for you. So I do wish you all the best in your career choices. I very much hope to see some of your names in our honour roll as we proceed through the next couple of years. But thank you again, and good luck in the future, and good night. Thanks, everyone.
Thank you. Thank you.
Good night, everyone.
Good night.
Good night, everyone. Thanks, Simon.